Let's talk about the medications. You can take medication to treat very bad diarrhea such as loperamide. Other medication to help with symptoms, these include fiber supplements, may help your symptoms become better. You may use acetaminophen for mild pain. Note that drugs such as aspirin, ibuprofen or naproxen may make your symptoms even worse. What are the medicines that may be prescribed by a doctor for a patient coming to you with a Crohn's disease? These medications include aminosalicylates, 5-ASA. These are medicines to help control mild to moderate symptoms. Some forms of the drug are taken by mouth. Others must be taken rectally. The second drug is corticosteroids. These are used to treat moderate to severe Crohn's disease. They may be taken by mouth or inserted into the rectum. Medicines such as azathioprine or 6-mercaptopurine quiet the immune response reaction. Furthermore, antibiotics may be prescribed for abscesses or fistulas. Note that biologic therapy is used to treat patients with severe Crohn's disease. That does not respond to any other types of medications. Medications in this group include infliximab and natalizumab. What about surgery? Surgery sounds hard, but patients who have Crohn's disease that does not respond to medications may need to undergo surgery, especially when there are complications such as bleeding, hemorrhage, failure to grow in children, fistulas, infections, abscesses, and narrowing strictures of the intestine. Note that some patients may need surgery to remove the entire large intestine, colon, or with or without the rectum. What about the prognosis, the outlook for a patient with Crohn's disease? There is no cure for Crohn's disease. The condition is marked by periods of improvement followed by flare-ups of the symptoms. It is very important to stay on medication for long term to try to keep the disease symptoms from returning back. You have a higher risk for small bowel and colon cancer if you have Crohn's disease. What about the possible complications that may occur for a patient with Crohn's disease? These include abscess, bowel obstructions, complications of corticosteroid therapy such as thinning of the bones, erythema nodosum, fistulas in the areas like the bladder, the skin, vagina, impaired growth and sexual development in children, inflammation of the joints, lesions in the eye, nutritional deficiency, particularly vitamin B12 deficiency, pyoderma gangrenosum, hemorrhage, life-threatening chronic inflammation, and cancer. What are alternative names that you can find a person calling Crohn's disease, like regional enteritis, ileitis, granulomatous ileocolitis, IBD, Crohn's disease? So if you hear any of these names, he's referring to Crohn's disease. What about the differential diagnosis of small bowel Crohn's disease? Differential diagnoses include other causes of right iliac fossa mass like cecal carcinoma, appendix abscess, infections like TB, actinomycosis, mesenteric adenitis, pelvic inflammatory disease, and lymphoma. What is the management, which is very important for a patient that comes here with Crohn's disease? The key aim is to, 1, treat the acute attacks that come for the Crohn's disease patient, prevent the relapses, detect carcinoma at an early stage so that you will prevent the complications, select patients that need surgery. Let's now compare ulcerative colitis with Crohn's disease. Both of these are inflammatory bowel disease. First of all, let's talk about the age group in both of them. In ulcerative colitis, the age group is any age group. When compared to Crohn's disease, also any age group. The gender for both of them can come in male or female. Thank you for watching and looking forward to see you in the next video with a new